So welcome to everyone, and without further ado, I think I'll kind of jump right into things. My name is Leah, and I'm the Knowledge Exchange Coordinator at Women's Shelters Canada, and so I'll kind of be hosting or moderating today's webinar. And we're really excited about today's webinar. Before we jump into the main topic and I'll introduce our presenters, I'm just going to tell you a little bit about Women's Shelters Canada. So Women's Shelters Canada provides a strong, unified, pan-Canadian voice on the issue of violence against women at a national level. And so we were kind of created in 2012 by the provincial and territorial shelter associations to kind of have that representation at the national level. And so our work focuses on connecting shelter associations across provincial and territorial boundaries so that everyone can kind of exchange knowledge, share practices in order to strengthen the work that you all do. And of course, we also advocate at the federal level to make sure that the insights and experiences of shelters are informing the policies and legislation that affect your work. And so I want to highlight a few resources that we have put together as part of kind of some of our knowledge exchange work during this COVID-19 kind of period or crisis. And so I'll just talk about them quickly, and then I'm going to put some links for those into the chat box once I'm done talking, so you can use those links to access the resources. And so we have created a closed Facebook group, so private Facebook group for shelter and transition house staff across the country to connect with each other and share. And so I'll share the link, and if you want to join that, you can just follow the link and request to join. And then you'll be able to kind of join that group to connect with other people across the country doing similar work. We've also kind of compiled a Google Doc that has a list of resources and practices in different categories that, you know, might help you if you're trying to figure out, oh, like, you know, it'd be helpful to see an example of another shelter's pandemic policy or some tools they're using to work with children, for example. So that kind of resource is all up there. And we also, of course, have a resource page on our website to kind of share further resources. So lots of information there that we're collecting and we hope can be useful to everyone who's sort of, you know, doing the frontline work in shelters at the moment. And so I will share those links in just a minute once I'm done speaking. So without further ado, today we are here to talk a little bit more about adapting the services that shelters are offering to women in the community during COVID-19. And so we have with us Lynn Loeppky, who is the Executive Director of the Revelstoke Women's Shelter Society. And she's going to talk to us today a little bit more about how they've shifted some of their outreach programming into a virtual format and recruited volunteers for kind of a community delivery service for women in need in their community. And then we'll hear from Sandy Watson-Moyles with the Three Oaks Foundation. And she's going to tell us a little bit more about how they've been using texting as a way to communicate with women, some of what they've learned from that, and some of the other work they're doing. And then we will have some questions and discussion. And so, you know, we do hope that this webinar can be a pretty tangible kind of practice-focused webinar. And you know, obviously everyone's in a really different situation across the country. Every shelter is a little bit different, but we hope, well, everything might not apply to you. Everyone can walk away with kind of one or two ideas that you think you might be able to try at your shelter. And to help us meet that goal, we are relying on your participation for those of you listening. And so throughout the presentation, you can use that chat box, that Q&A at the bottom, to post your questions. And at the end of the two presentations, we'll have time to go through your questions. If you have a practice or an experience that you want to share, you can also share that. And I can share that with everyone else at the end after the two presentations as well. So This on your screen right now, you can see kind of the Q&A box for your questions or your experiences you want to share. There's also a chat box if you want to say hi, or if, you know, when I'm sharing resources, I'll put those in the chat box. And so you're welcome to use that. But for your questions, I encourage you to use the Q&A box because it just makes it a little bit easier for us to keep track of those, so we cover everything at the end. Awesome. And so without further ado, I'm going to pass it over to our first presenter, Lynn. And so I will stop my screen share there so that you can share yours, Lynn. And just, sorry, before you jump into that, Lynn, I'm just going to respond to a question in the chat. La traduction est par téléphone. Alors, les instructions sont dans le messagerie, mais la ligne de conférence, c'est 1-866-512-0904. Et avec le code de participant de 256-8662#. So for those of you wanting translation, you can use that conference line. So Lynn, why don't you jump into it?
All right. Hi everyone, I'm Lynn Loeppky. I'm the Executive Director from the Revelstoke Women's Shelter. I have a slide presentation. Is it up for everyone?
Yep, we can see it. Thanks, Lynn.
You can see it. Okay, I'm just going to start from the beginning. So we have a number of programs within our shelter. Moving Forward, Moving Mountains, the CRN, which you'll hear a little bit about. All of those programs came together and developed a program called Social Response to COVID-19. So I'm going to start just with a little bit of history in terms of the programming. So in 2014, the Revelstoke Women's Shelter started an outreach program for women and their children that were former residents of the shelter. We did this recognizing that women would benefit from staying connected after their stay. We don't have second stage in Revelstoke, so it was kind of our way of developing that. So since 2014, the program has grown and evolved in a program that provides service to all vulnerable women and children in the community. The existence of the Moving Forward program created a community of women who, through activities and workshops, were able to stay connected with the shelter and at the same time form friendships that became long-lasting. So a number of our women have actually become quite good friends, and their children have become friends. The connectivity formed through trauma-informed practices such as yoga, watercolor painting, meditation, and also mountain retreats. We're all part of forming that connectivity. We have some Aboriginal programming as well. So we do a lot of beadworking, making dream catchers, and we have an elder that is called in for support when needed. We also do individual support and advocacy, which is offered through our coordinators, and that's offered or was offered face-to-face or through texting or email or phone. So we had to rethink our programs once the pandemic hit. And so the Moving Forward program had to adhere to the safety and social distancing recommendations and has had to rethink how to best support women in maintaining connectivity. The programming now takes place through Zoom. We offer trauma-informed yoga, meditation classes 3 times a week. We have art kits that have been delivered and provided for women and their children so they can continue to explore and heal through the creativity while staying at home. We are also offering art classes online, and that's new. Zoom memberships are paid by the program, and that's to ensure that members can have the best security possible through Zoom. We have one-on-one support. It continues through texting, emailing, phone, or Zoom. The share screen option we find has been quite useful in helping women fill out government forms, particularly for the new government forms for funding. So the program expanded through the COVID crisis, and our membership has grown. We have added a virtual vision board making workshop. We have a creation of our online cookbook, which we share. We have music jams and weekly check-ins. We also have online resources on parenting through COVID-19, mental health resources, and virtual law clinics, which are all shared through our Facebook page and our website, which the website link is there as well. So we had to collaborate in order to create this program, and we wanted to offer the community more during this time, as well as something that we can continue into the future. So we partnered with the Community Response Network program, the Moving Mountains program, which is a men's program, and the Hospice Society. We expanded our services to include delivery of groceries and other essential goods to vulnerable people in our community. Moving Mountains, this was a program, this is the men's program. This program was developed by our shelter in 2018, recognizing that men in the community had little to no support. In conversation with other agencies, there was a gap in services that could be directly affecting families. And so we've seen this as a really good prevention program. Offering a men's peer support group that focused on weekly activities such as men's fireside conversations, wood carving, and coffee meetings may help the men feel less isolated. We also partnered with the Aboriginal Society to have the men's fireside conversations. The coordinator offers individual support and advocacy. COVID-19 has seen an increase in men reaching out through texting, emailing, and phone calls. In fact, we've started to actually have this program running 3 times a week versus once. The Community Response Network is an independent provincial project by the BC Association of CRNs, which focuses on education and prevention of the abuse of older adults and self-neglect of vulnerable adults in the community. Its main focus is creating coordinated interagency response to adult abuse of all kinds. We hold this contract, and in the past few years, we've expanded the program to include projects such as intergenerational programming at schools and senior residences. This morning in our staff check-in, we are also going to try and keep that intergenerational program going through maybe a pen pal type program. The Hospice Society, that's where we're matching seniors to volunteers through what's called the TREE program. So with growth and expansion, the partnership between the Moving Forward, Moving Mountains Community Response Network and Hospice was a direct response to the COVID-19. And in forming these partnerships, we found that we needed to do a number of different things. So we needed a volunteer base. We needed extra liability insurance. We needed confidentiality forms for both the volunteers and the clients involved. We needed liability waivers. So with the COVID-19, we needed to make sure that if people were delivering groceries, that they were well aware that there would be a waiver, that they were waiving any liability towards our business or our society. And then we had to collaborate with businesses and with the community agencies. So in establishing this base, we put out a call for volunteers and we received about 30 responses. Out of 30, we screened and interviewed, and we have about 15, I think, that are quite committed to the program. The volunteers were required to send in a resume. They were interviewed. They had to go through criminal record checks, and they had to commit to the program. The criminal record checks are probably the piece that was the most timely, but a lot of the volunteers already had record checks done through other organizations or for other volunteering purposes, so we were able to share those checks. The creation of the new database of volunteers from the community that were willing to help vulnerable adults, seniors, immune-compromised adults, and more enabled us to make the next steps. We worked with the RCMP, our lawyer, and the insurance to establish the program in a timely manner. We connected with local grocery stores and pharmacies to create partnerships. With their assistance and willingness to help, we established a method in which individuals could order and pay for their groceries or medications through the companies. The volunteers would then pick up the orders and deliver them to the door without actual face-to-face contact. And then there was a collaboration with the other agencies. So the shelter contacted and reached out to our local food bank to offer food hamper pickup and delivery 3 times a week with the assistance of Handy Dart to referred clients. We then had another partnership with the Southside Food Mart to provide online or phone orders. The hospice partnership offering phone support, and volunteers who were making masks and for the volunteers and for the staff. And we also had hand sanitizer donated and handed out by Monashee Spirits Distillery, which is a local distillery company. We have referral forms, which we created, and individuals can actually self-refer to this program, and they can do that through any one of the agencies, the partnering agencies. And they can also find the information and the referral form on our revelstokelife.ca website. We had social media posts. The City of Revelstoke Social Development Coordinator mailed out the referral forms to all the agencies. We created flyers, and so there was a bit of a distribution of those, which was more virtual or online. And then we had a news article that promoted the program. So in summary, social response to COVID-19 has created a platform in which vulnerable individuals in our community can stay connected and heal during the pandemic. And to provide the best service possible, we had to be very flexible, watch and listen for what our community members were saying. We feel that women are more at risk during this time, and keeping them connected is vital to their survival. We believe there is more that we can do to help women and children. We feel that this is just one step in keeping people connected and helping to prevent abuse. And that's the end of my presentation.
Awesome.
So I will stop share.
Sure.
There.
Perfect. Well, thank you so much, Lynn. So there's lots of interesting details there about what you've been working on, and it sounds like you've pulled together quite a bit within, a few weeks. So that's really impressive. So just a quick note before passing it to Sandy, that we are going to keep questions until both Lynn and Sandy have presented. So I know there's one question already, and I'm sure other people have some in their mind. So you can keep putting those in the Q&A or the chat, and we will come back to those once we've heard from Sandy. So don't worry, we aren't missing your question. So thank you, Lynn. And Sandy, over to you.
Thanks very much. That was great, Lynn. It was making mental notes myself going forward. And thanks for including me in this. It was a rather quick turnaround, but I do appreciate that. Just to bring you up to date on some of the things that we're doing, and I'm quite certain that a lot of the things we're doing aren't unique. I know some of our sister shelters in the province are doing them. I'm assuming that there are others across the country as well. But one of the things that we did do in the last 2 years, because our services enter areas that are so remote from services with cell phones and the towers, we've been replacing everything with laptops and cell phones anyway. So COVID didn't actually put us into much of a crisis as far as that piece of providing services remotely goes. And the other thing we were able to do, because we were able to access the Rogers services through the provincial government and their vendor of record, we were able to get unlimited access to data. So we can tether our laptops to our cell phones, and our staff members who are providing services in areas where at best cell phone or range internet coverage is not great are able to continue to maintain services with their clients. Something else that we've looked at and we've done is more accessing Facebook video than Zooms, because the women have access to Facebook for the most part, and that seems to be something they're comfortable with. And some of the staff have also gone to the point of creating private chat groups with their clients on Facebook, so that there's an element of security that's attached to that as well. As far as the shelter is concerned, we didn't do a full remote texting capacity at the shelter, because so many of our clients they're already accessing through our website for counseling services or information if they only have data. So what we've done and what we've done in the past and continue to do is any of our info questions that come through our website go directly to our counselors at the shelter, and they're able to address the questions, concerns, and or crisis immediately with the clients, because they check them on a regular basis. And we found that to be really important and really worthwhile for the women, and they've appreciated that too. Some of the things that we're finding with our extended counseling and our remote counseling is that our staff are having to extend their hours beyond what would normally be our work hours, because a lot of the women are also at home providing childcare for school-age children or younger children who are no longer able to access daycare. So the staff are experiencing, I dare I say, fatigue from extending their work days beyond what they would normally be expected to work in order to accommodate the needs of the women, because of course the women don't want to discuss their private issues in front of their young children. And one of the other things that we've had to deal with is the remote, providing the remote services is without having eyes on the counselors. I think there's a level of frustration that they can only get the impression from the woman over the text or telephone call, and there's a lot to be lost when you're not able to see someone face to face. So they're experiencing some issues that way, but also in some of the information that's being provided remotely by the women, such as very graphic pictures of some of the injuries they've sustained at the hands of their abuser, and very little or no desire to have the police involved. So that there's that dilemma as well that staff are faced with. You're more hearing about it when you're in counseling sessions, as opposed to seeing the pictures coming across your phone screen. So I think that creates some difficulty, certainly emotionally, and to increase the stress level of the staff who are providing these services. Something that we have as well that some shelters I'm sure do or don't, we have second stage housing. In Ontario, we're one of 3 provinces where we don't receive government funding to provide services to second stage. So they're all self-funded within the province of Ontario, whether through grants or rent-geared incomes. And we found it necessary to increase our direct services to second stage clients, being able to provide them with the personal protective devices, increased groceries that normally they would have accessed on their own, but they're unable to go out and secure, and also the cleaning supplies, because they just couldn't afford to purchase the things that were necessary to keep their homes and their immediate areas sanitized. So that's something that we found more demanding of our services. When a woman moves to second stage, we always provide a sort of a hospitality basket to her that does include some basic necessities that if you were to go out and replace all of your things immediately would be a great expense. And we know that. So a laundry hamper that has some laundry detergent and things like that. But with COVID, it seems to certainly have impacted everybody's budget, and there's definitely some issues finding supplies. So we were able to distribute necessities like toilet paper that they couldn't find on their own, or hand sanitizer that we had to scrounge ourselves so that we could provide that for them. Three Oaks is located in, I like to think of it as urbanly rural and rurally urban, because our biggest center is 40,000, 50,000 people. We're not a huge metropolis, and then we get smaller from there. So we also face some of the issues that we face on a daily basis, whether there's COVID or not, such as lack of transportation, as mentioned before, lack of good cell reception or internet provision. So having to enhance our own services so that we can provide those things for our clients and certainly our staff has been a challenge and continues to be a challenge. I know that, again, because we're a smaller shelter, we're only 16 beds, a lot of our community-based staff are also doing double duty and coming into the shelter and providing screening shifts for us, because, of course, we've had to double our staffing through all this so that we can adequately screen people coming and going. So that's been an interesting shift as well for them in being able to do their own outreach work, but also coming into the shelter to assist. The numbers, interestingly enough, in our shelter are low. We did see a bit of a peak over last weekend, but then they dropped again. And but our outreach is fairly consistent. And I think that's because a lot of women, given the druthers of attending at shelter or staying at home, are probably putting up with things that they otherwise wouldn't put up with and may come to shelter because they know that there are restrictions. We've had a couple of interesting situations where we've had women call us asking for a video tour of the shelter to see if it was adequate, and also wanting full descriptions of all of our programs, not just an overview that you might get through a website, again, to see if they wanted to access our shelter. So I'm not certain if people are shopping around or what's going on, because those are
Sandy,
situations that we have not.
Sorry, I'm just going to pause for 1 second because I think the translation was lost for a second, but it's back online now. So go back, maybe repeat the last sentence you said and then jump right back in.
Sure, if I can remember it. Once it's out of my mouth, sometimes it doesn't come back to my brain. So so we'll have to see about that. Some of the things that we've been utilizing, and I know I see a staff member on the webinar today, hi Heather, is that the staff are having an opportunity to access different trainings that have been on their to-do list for a very long time, and maybe this is some of the silver lining that's available to people who are under restrictions, so that they're able to access the different webinars and different trainings that are out there, and then thereby enhancing our services ultimately to the women through our own learning, and then finding out through people like Lynn the kind of different things that are going on, not only in our local region, but certainly provincially and nationally, and would definitely encourage people to access the Ontario Not-for-Profit Network and also the Ontario Association of Interval and Transition Houses to, if they're, certainly you can access that from anywhere in the country, but definitely in Ontario, to see the kinds of things that are being rolled out. Fortunately, there's been a lot of support for our services, at least in Ontario, by different levels of government. I know that other areas are not hasn't been as beneficial to them as it has to us, and we're accessing all of those things and trying to make our services as seamless to the women who need us as we can.
Perfect. Thank you, Sandy. That's great. So again, lots of really interesting information there. So thank you to both of our presenters. If you have questions, if you're listening in and you have questions or thoughts that you want to share, I'd encourage you to put those in the Q&A box and the chat. And we have had one in already, so we'll start with that as other people are kind of thinking of what they want to ask. And so Lynn, there was a question for you. You had mentioned that you are purchasing Zoom accounts or memberships for your clients. And so there was a question around, is that for all clients, or which ones are you purchasing that for? And I'm just going to add to it, maybe you can also say a bit about what the benefit of doing that is, like what's the kind of advantage of having a paid account?
Okay, well, I'm going to start with, we started out purchasing the Zoom for our coordinators, and then our coordinators can invite people in. And then we decided that we would pay the Zoom memberships for those that participate in the yoga and the art, and so the programming itself. We are in process of buying some iPads and a phone with data that we can have as sort of a loaner for participants, because a lot of participants don't even have Wi-Fi. So we're in the, like I said, we're going to purchase some iPads, and then we can loan those out on a loaner basis. And we're sort of going through the process of figuring out how we can do that. So I guess first they would have to request it, and then we would make sure it was clean, delivered to their door. They could pick it up from their door, and then put it back out when they're finished, and then we would clean it again. So there's a little bit of logistics there to figure out how we're going to do that, but that is sort of our plan. The benefit, I think, is just keeping people connected in any way that we can, especially women. It's interesting, our outreach numbers have probably tripled. There's a lot of women that are participating in the activities, and we feel that's because they're trying to, keep that connectedness, and we're hoping that it's preventing ongoing abuse. I don't know did that answer everything?
That's great, thanks, Lynn. I had a question for Sandy. Oh, there's a question in the Q&A, so I'll default to those ones first before I ask my own questions. So Sandy, the question is that you brought up, a bit of fatigue maybe from employees or staff due to some of the shifts in kind of those communication styles, maybe the different hours, that kind of thing. Yeah. So what are some of the kind of strategies or approaches that you've put in place to kind of make sure staff are staying energized or refreshed, and just sort of dealing with that question of fatigue coming out of this?
Sure. So the manager that's responsible for supervising the community-based programs does regular check-ins with the staff, and also we've been maintaining our staff meetings through Zoom so that we can stay connected that way. And right at the very beginning, we set up a private Facebook chat with the staff, and its really sole purpose is to post silly memes and just to keep each other amused and have a little fun with each other, because we can't be together to do it.
Great. And I had kind of a related question to that as well, Sandy, because you had also talked about some of the, because it's not necessarily the face-to-face in-person counseling or engagement, that there's some things that are lost in that that don't come across by text. And so are there any strategies that your staff are using to kind of compensate for that, or make sure they're still getting the information they need, even though maybe they're losing some of that face-to-face, in-person relationship or contact?
Well, I think that, for the most part, what they're doing is just asking the questions to make sure that they're getting the information. Certainly with texting, there's a lot lost. I know we've noticed over the last little while that although our numbers of contacts have been consistent, and this is beyond COVID, this is just in general, the actual hours of time spent with the clients is drastically reduced. And we think that's because with texting, people are very quick. There's the whole short forming that happens, and you just get your point, you state your piece, and then you move on. Whereas when you have the communication that's face-to-face, there's more chatter that happens, and naturally the conversation just evolves. Whereas with texting, and even a phone call, it seems to be pretty quick and to the point. So it's just getting to that point where you're asking the questions to make sure that the woman is able to disclose as much as she's willing to disclose, and then seeking, offering to help her through her options to seek some further assistance if need be.
Great, thank you. And so a reminder to people that you can post your questions, but I'll keep going with my questions in the meantime. And so Lynn, I was just hoping, and actually maybe Lynn and then Sandy, I'm sure you can jump in on this as well, but Lynn, so you have described like a lot of programming that you're offering, right, and the delivery service and all of that. And so I was just wondering, I'm sure some people are wondering, have you been doing that kind of all with existing funding that you had? Were you able to get any sponsors for that or anything? So just how have you kind of, managed to make that all happen on such short notice, basically?
Okay, so interestingly enough, none of our programs are funded through government funding. All of our funding comes from grants and donations and from grant writing. So I have a staff member that does all our grant writing for us. We're lucky that we are in the Columbia Basin, which means that we get Columbia Basin Trust funding. It's actually a BC Hydro funding. So Revelstoke has the Revelstoke mica and Revelstoke dams, and so we receive a lot of funding from the basin. And when the COVID-19 pandemic hit, they reached out to our agency because our Moving Forward and our Moving Mountains is already funded through them. And they reached out and asked if we needed additional funds. And so I said, that would be fantastic. And so we received a lump sum from them to get this program up and running. So another place that we get some of our funding from, which is probably more across Canada, is Mary Kay Foundation. The civil forfeiture funding, and then like there's a lot of local places. We get it through our community foundation, through our Revelstoke Credit Union Foundation. So what I suggest is for people to just reach out to different agencies and different places. So our Revelstoke Credit Union, for example, they love to give money back to the community. So, if you do have a local credit union or Southside Food Mark here, which is a privately run grocery store, they gave us $2,000 towards supplies to disperse. So, yeah, so I guess that's how we get our funding. Any way we can.
Definitely. Sandy, did you want to add anything?
Can you go back to the very beginning for a minute? Because I was just really interested in hearing where Lynn was getting all of her funding from.
Oh, to the question you mean?
Yes, please.
Yes, I was just asking kind of, with some of this additional, or the new or additional things that you're doing now during COVID, how have you managed to get funding for that? Or is it coming out of existing budgets? that kind of thing?
So the answer is yes to all the above. We are certainly seeking out additional funding. We've had some offers of grants from different organizations, which has been very helpful. Certainly the federal money has been helpful in moving forward, and our provincial money, we apply for that after the fact. So we'll recoup some of the dollars that we've spent. We actually haven't extended our programming. We did discuss with the women at the very beginning who were part of our groups, and they asked to hold on to the groups until this was all over. If this continues much longer, perhaps they'd want to reinstate them, but they just found it would be really difficult for them to participate in a group process, and they asked to just not do it. So yeah, we're just looking everywhere and anywhere for funding. I don't think it's going to be enough, but never is. So
for sure. Awesome. So I'm just going to give 30 seconds or so for anyone else who has a question to put that into the chat box or the Q&A, or if anyone on the phone line has questions through the translator. So I'll give people, like I said, just a few seconds to do that. And we do have one here. So the question is, when you provide women with iPads for groups, or iPads or other technology, I'd assume, are the women allowed to use them for other things, or how do you are there restrictions or parameters around that?
Yes, so we would deliver, say, right before groups and pick up right after groups, and the data is actually restricted. Through TELUS can actually restrict so that they can restrict it on the device itself so that they can't use it to watch Netflix. So.
Great. Okay. Thank you. Perfect. So if anyone else has a question, feel free to pop that into the chat or the Q&A box. And so it looks like there may not be other questions coming in. And so I think Sandy or Lynn, unless either of you have anything else that you want to add, we can sort of wrap things up there if there's no further questions. So I just wanted to say thank you so much to both of you for your great presentations and for sharing with everyone. Sorry, I'm seeing someone who wants to share kind of their own experience. So give me one moment because I just need to unmute that participant. Okay, so Heather, you should be able to speak. You'll just need to unmute yourself, or I think I can do it for you. Oops.
Oh.
Go ahead.
Hi, thank you. Hi, Sandy, it is me. I just wanted to share, though, something that, as being an outreach worker, some things that are certainly concerning is when we get new referrals and our client is still living with the identified abuser and she's not able to do anything via phone or FaceTiming or anything like that because the abuser is off work and home with her, and when she's restricted from going places. So it's pretty alarming. And the only thing I can say to that is with those particular situations, I usually send off a text because I'm told that's the safest way, but yet the woman wants to meet in person. So it is frustrating for us as workers when we come across those kind of situations. I just wanted to be able to share that. And yes, with the way our agency has set us up with our phones and our laptops to be able to do our work and still stay connected with our women has been awesome. So I just wanted to put that out there. Anyway, that's what I wanted to say.
Great, thank you. Thanks for sharing. I'm seeing that has prompted another question here. So the question is, Wondering what the experience has been dealing with police response during this time. So have your communities let offenders out early? Or what has the police response been? So I don't know, Sandy or Lynn, if either of you or both of you want to comment on that.
I can certainly, you know, from our point of view, we haven't had any need up till now to involve the police, thankfully. I do know that there are some conflicting reports on the number of domestics that the police are receiving. Some are saying that it's increasing, but they have a pretty broad spectrum that they look at under the lens of domestic calls, so that, you know, pretty well any call to a house they would consider a domestic, whereas we refer to that obviously differently. We have pretty good relationship with both. We're covered both by municipal and a provincial police, so in our areas, then we have pretty good relationship with all of them. And they usually generally respond pretty quickly when you make the call. So I would guess that that would continue through this as well. I just wanted to add quickly, sorry, Lynn, just to follow up on Heather. One of the things too that we are now doing is not only asking a woman if she's safe, but making sure that he's not present, because we've since found out that some women are accessing the counselors while their partner is present and things aren't going awry, and then when they do, it's then being used against them. So we're making those determinations over and above just making sure that they're safe.
I was just going to add that we have a pretty good relationship with, we're RCMP based, but we have a pretty good relationship with the RCMP. They come pretty quickly when we call. They are also saying they've had an increase in domestic calls. Again, like Sandy said, that's kind of, you know, their perimeters, probably maybe not ours, but they've been able to sort of handle those from what I've told. Like Sandy, I think our outreach is increasing, and our house numbers, our transition house numbers are staying pretty stable. And so we're a bit concerned. We don't know whether that's because people are stuck at home with their abusers, and maybe once restrictions kind of ease and men start going back to work or leaving the home, whether we'll suddenly get sort of a real increase in numbers.
Thank you. And so there is a question, another question here, whether anyone has worked with someone who's been diagnosed with COVID-19, so whether that's come up yet at one of your shelters.
It hasn't for us. We have had 2 of our staff members have to self-isolate due to exposure, but neither one of them presented with symptoms and got through their isolation and are back at work. So no, we have not. I know in the province of BC, there are hotel rooms available for people, well, for women presenting with symptoms. So rather than them coming into the transition house, we can put them up in hotel rooms.
We had one woman in our second stage that she was showing symptoms, and she was working in the seniors home where the outbreak first happened in Belleville. She was put under quarantine and tested, and it came back negative, although we do know that there are some tests that are coming back with false negatives, so we're not certain. But we're able to, they're self-contained apartments, so they don't need, there's no common living space. They can self-isolate. And in the shelter, we haven't had anyone present with symptoms, so that's been great. But we have been able to secure a room in our shelter that has an ensuite bathroom that we can use for isolation if we need to, because the only isolation place that's been created in Belleville is for the homeless population, and our women haven't been included in that, and I'm not certain if that would be the best place for them to be secured anyway. and then we would access hotels if we had to keep them safe and secure.
Great, thank you. And I just want to share as well, someone has shared an experience with this in the chat. And so they're saying that where they are in Campbell River, they've had a few women with flu symptoms. And so they weren't tested, but they assumed that they were positive to be safe. And so it sort of they delivered food to them and things like that. So there was a bit of extra work for staff just in managing that, they're saying. And the person who shared that experience, if you did want to say more about that, let me know in the chat box and I can unmute you if you want, but there's no pressure. So I'll
I just want to add on that, if I could, Leah, that seems, for us, it's one of the biggest issues is the inconsistencies amongst our health units across the province. And also with Health Canada, they're saying, if you answer yes to 2 symptoms, that's not always the case. 1 symptom is enough for them to treat you as if you're positive until you can have a test and have that rolled out. So that's definitely an issue that we've dealt with in a staffing place with a partner of one of our staff, but it was a headache.
All right, great. So again, I'm just going to give 10-15 seconds there. I'll kind of pause if anyone is typing any questions in or wants to share anything else before we wrap it up. I just don't want to cut anyone off if they're mid-sentence typing.
I can just share that in our transition house, in order to sort of mitigate symptoms, we have now determined that one family will share one washroom. So we've tried to have separate washrooms for all women. And we've upped our cleaning, which I think is just probably practiced across the board, but we're cleaning 3 times a day. If women do go out of the shelter for any reason, when they return, they're asked to shower and change their clothes. And we have a hand washing station at the door when people sort of enter the building. So just some sort of practical things, I guess, that we're doing.
Okay. And there is one other question that's come in here. And so I think the question is, if a woman or a resident were to test positive, would staff have to then go be quarantined? Staff who've been in contact with that woman, what are the policies that you have in place around that in your shelters? I don't know, Sandy or Lynn, if either of you kind of have some policies in place for that, even if it hasn't happened yet.
So the quarantining of the woman can take place in the unit that we've set aside that can keep her isolated from the rest of the house. As far as staff following through with staff, they would need to contact our local health unit, and then we would be obliged to follow through with their recommendations of that health unit, and we would roll it out as they determine. And I think there was a piece of that asking about payment. If the staff are paid, all of our staff have access to sick time, so through the agency, so they would have that, plus workers' compensation in Ontario could be proven to be a work-related illness, they may have access to that. I certainly wouldn't see any staff members suffer based on a disease or infection that they got through their workplace unnecessarily.
And I can add to that as well. It's similar for us. We pay our staff. So if they did have to go off, we would pay them for those shifts that they would lose, the 2-week time period. And we would probably put the client that presented with symptoms. We also have another self-contained room in our home that has a partial kitchen, a bathroom, laundry facilities, and so we would probably quarantine them there. And if we couldn't, we would put them up in a hotel room for that time. For staffing, again, it would be like Sandy said, they would contact our local health authority, and whatever they were told at that time, we would have to adhere to.
Great. Thank you. And so I'm going to wrap it up because we're sort of almost through our time together here. So I want to say thank you to Lynn and to Sandy for your excellent presentations and the additional information you've shared in the question session. And thank you as well to our volunteer interpreter who's been helping make sure that everyone across the country can participate. And thank you to everyone who's been listening in and sharing your questions. I think it was a great discussion and lots of really interesting topics covered. So thank you so much to everyone. And I will share a recording of the webinar and any resources that have come out of this by email probably next week or in the next few days once it's available. So thank you very much.
Thanks, Leah, and everyone stay well, stay safe.
Awesome, thank you. Yes, and stay well, everyone.
Thank you.
All right, bye, everyone.
Bye.